All right, so let's jump into an EMT scenario that'll really test those assessment skills.
Yeah.
Imagine you and your partner get dispatched to a skate park.
Skate parks, yeah, they're super popular, but we do seem to be seeing more and more injuries from them. Lots of gnarly wipeouts, you know?
Right. It seems like those half pipes and rails can be pretty unforgiving. So let's say you arrive at the skate park, and there's an 18-year-old male holding his left arm close to his chest, obviously in pain.
Oh, okay.
He's conscious and talking, which is a good sign,
Right,
but there's definitely something wrong.
for sure.
What's your first move?
Well, first things first, like always, scene safety.
Oh, of course, yeah.
Gotta make sure there are no hazards to us or the patient before we even think about going near him.
Right. Safety first. So let's say the scene is safe, and we're approaching the patient. What now?
Okay, so now it's all about that initial assessment. Gotta figure out what we're dealing with.
Okay, so we've secured the scene, we're with the patient. Now we're moving into that full assessment, starting with the ABCs. What are we looking for here?
All right, so ABCs, airway, breathing, and circulation. These are always our top priorities. Always.
Always.
Is his airway open? Is he breathing okay? Does he have a good pulse?
Right.
We're looking for any signs that he needs immediate help with any of those.
Okay, so let's say our skateboarder's airway is open, he's breathing well, and we've got a strong pulse. What's next? Do we jump straight to examining that injured arm?
Not so fast. Before we start touching, we need more information. This is where the sample history comes in.
Sample history, right. It's
Yeah.
like our guide to understanding what happened and the patient's overall health. But I always have trouble remembering what sample stands for.
Oh, yeah. I get that there are a lot of mnemonics to remember in EMS, but think of it as starting a conversation with the patient. S is for signs and symptoms, like what's going on? What does the patient feel?
Okay.
A stands for allergies. Got in if they're allergic to any meds, right? S is for medications. What are they currently taking? P stands for past pertinent medical history. Have they had similar injuries before? Any relevant health conditions?
Okay.
L is for last oral intake, which can be important for procedures or medications.
Right.
And finally, E stands for events leading up to the incident. How did the injury happen? What was he doing?
Ah, that makes it so much easier to remember. So we're chatting with our patient, getting his story.
Exactly.
Let's say he tells us he fell while trying a new trick, heard a pop, and immediately felt intense pain in his left forearm.
Okay.
He denies hitting his head or losing consciousness. What now?
All right, so now we can move on to checking out that injured arm.
Okay.
But before we start touching anything, gotta understand his pain level.
Okay, so how do we do that?
That's where OPQRST comes into play.
OPQRST, another mnemonic. Sometimes it feels like there are more acronyms in EMS than actual medical terms.
Uh-huh, maybe. But they're super helpful.
Okay, I know. So break it down for us. What does OPQRST stand for?
Think of it like you're a pain detective, Ari. O is for onset. When did the pain begin?
Okay.
P is for provocation or palliation. What makes it worse or better? Q is for quality. What kind of pain is it? Sharp, dull, achy.
Okay.
R is for region and radiation. Where exactly is the pain? Does it move or spread anywhere else?
Got it.
S is for severity. We need a number here. How bad is the pain on a scale of 1 to 10?
Right, the pain scale.
And finally, T is for time. How long has the pain been going on? Is it constant or does it come and go?
Wow, that's a lot of info to gather just about pain.
Yeah.
But I see how those details can really tell us how serious the injury might be.
Definitely, yeah. So let's say our patient says the pain started right when he fell. It's super sharp and intense. It's in his left forearm and it's constant. He rates it an 8 out of 10.
You
And moving his arm makes it even worse. Now we're starting to get a better picture of what we might be dealing with.
Okay, so we've got the ABCs checked, the sample history gathered, and we've used OPQRST to assess his pain. What's next?
Okay, now it's time to get hands-on, literally. We got to examine that injured arm. We'll be looking for any signs of a fracture or a dislocation.
Okay.
But before we even touch him, what should we do?
I know this one. We need to get his permission before we touch him. We have to explain what we're going to do and make sure he's okay with it.
Exactly. Building trust is super important. Makes the whole assessment smoother and less stressful for everyone.
So we've got consent. Now we can examine his arm. What are we looking for specifically?
We'll be checking for anything unusual like deformities, swelling, bruising, or open wounds. We'll also feel around the area gently, checking for tenderness or crepitus.
Crepitus. That's that crunching or grating feeling you sometimes get with fractures, right?
Yep, that's the one. Not a good sound.
Not at all.
Yeah.
So let's say we see some swelling and bruising around his left forearm. And when we gently touch the area, he winces in pain and we feel some crepitus. What do you think? Are we leaning towards a fracture here?
It's definitely a possibility, but we're not done yet. We need to assess his circulation and nerve function before we move on to splinting.
Right, checking circulation and nerve function is really important, especially if we're thinking it could be a fracture. Got to make sure the blood is flowing and he has feeling in his hand.
Okay, so how do we check that? Is this another one of those mnemonics I gotta remember?
You know it. It's all about those mnemonics. For this, we've got the 6 Ps. Stands for pain, pallor, pulselessness, paresthesia, paralysis, and pressure.
Wow, 6 Ps. All right, break it down for us. What are we actually looking for with each of those?
Okay, so first up, we already assessed his pain, so that's covered. Next is pallor. So we're looking for any paleness or discoloration in his hand.
Okay.
That could mean the blood's not flowing well. Then we've got pulselessness. Pretty straightforward. We're checking for a pulse in his wrist.
All right, let's say I can feel a pulse, but it's weaker than on his other side. What does that mean? Ooh, that's not good. Could mean the fracture is pressing on a blood vessel and that's restricting blood flow to his hand. We need to take care of that quickly.
Okay, so we've got pain, maybe some pallor, and we're worried about pulselessness. What about those other 3 Ps?
All right, so paresthesia refers to any weird sensations, like tingling or numbness.
Okay.
We'll ask our patient if he feels any of that in his hand. Then there's paralysis, so we're checking if he can move his fingers. Can he make a fist? Can he straighten them out?
Let's say he can move his fingers, but he says they feel kind of tingly.
Okay.
And then there's that last P, pressure. What's that all about?
Pressure, that's all about compartment syndrome. It's a serious condition that can happen when there's too much pressure building up inside a muscle compartment,
Okay.
usually because of swelling or bleeding. That pressure can actually cut off blood flow and damage nerves.
Oh, wow.
And if it's not treated quickly, it can lead to permanent disability.
Whoa. Compartment syndrome sounds scary. So how do we check for that?
We're looking for signs like pain that keeps getting worse, swelling, and a feeling of tightness in the area.
Okay.
We'll also see if it hurts when we gently stretch his fingers. If we think it might be compartment syndrome, we got to get him to the hospital fast.
Okay, so we've checked his nerves and blood flow, and thankfully everything seems okay, apart from that weak pulse and some tingling.
Yeah.
No signs of compartment syndrome, which is a huge relief. So what's the next step in treating this potential fracture?
All right, now it's time to immobilize that arm.
Okay.
We're going to put a splint on it. This will help with the pain, keep it from moving around, and protect those bones.
Splinting, got it. But there are so many different kinds of splints. How do we choose the right one?
Good question. Picking the right splint depends on where the injury is, how bad it is, and what we've got with us. In this case, with the possible forearm fracture, we could use a rigid splint,
Okay.
something like a SAM splint, or we could use a soft splint, like a pillow splint.
So SAM splint or pillow splint. Got it. What are the important things we need to remember when we're putting the splint on?
The most important thing is to make sure that the splint is long enough to keep the joints above and below the injury from moving. So in this case, that means it needs to go from his elbow all the way to his hand.
Right, keep those joints still. But before we tighten that splint down, what do we absolutely have to check?
You got it. Got to check that circulation and nerve function again after we put that splint on, just like we did before. Make sure we can still feel that pulse and his fingers are still nice and pink and warm.
So splint is on, we've checked his pulse, his fingers look good. What else can we do to make him comfortable before we transport him?
We can give him a sling and swathe to support that arm and keep it elevated.
Right,
That'll help with the swelling and pain too.
excellent point. Sling and swathe. Those are key tools for us EMTs. So we've stabilized the injury, made him comfortable. Now what? Are we ready to take him to the hospital?
Hold on a sec. Before we go, we need to reassess our patient. Remember, reassessment is an ongoing thing. We got to make sure his ABCs are still good, double check that splint, and see how his pain is doing.
Right. Reassessment is so important.
Right.
But let's say everything looks good, he's stable, the pain's under control, and we're ready to go. What are the key things we need to do while we're transporting him?
First, we got to decide on the best way to transport him. Is this a load and go situation where we need to get him to the hospital ASAP?
Okay,
Or can we take our time a bit more?
that's a tough call. It depends on how bad the injury is and how he's doing overall.
You're right. But no matter how urgent it is, we got to communicate clearly with the hospital.
Okay.
We need to give them a good report of his injuries, what we've done for him, and if anything's changed with his condition.
Clear communication is key. We don't want any confusion or surprises when we get to the hospital. But before we hand him off to the ER, There's one more thing we absolutely cannot forget. Documentation. What are the essential things we need to document in this scenario?
Oh, you're right. Documentation is crucial. We got to paint a clear picture for the hospital staff so they know how to keep taking care of him. We got to document everything, how he got hurt, his initial assessment, his sample history, the OPQRST for his pain,
Okay.
what we found during our physical exam, the type of splint we used, any meds we gave him, and if his condition changed at all during transport.
Wow, that is a lot of information to document. But I can see why it's so important to have a complete record of everything we did. It's like we're writing the next chapter in his medical story, right?
Exactly. And don't forget, good documentation helps us legally too. It shows that we provided the right care based on what we found.
Okay, so the documentation is finished. We've handed off our patient to the ER team, and we can finally take a breather.
Phew.
What a wild ride. But going through that scenario step by step really helps me understand the whole assessment process better.
I'm glad to hear that. Reading about this stuff in a textbook is one thing, but actually putting it into practice is a whole other ballgame.
Absolutely. And this whole experience just makes me realize there's so much more to learn about musculoskeletal injuries. It's like a whole other world within EMS.
It really is. And as we've seen, these injuries can be anything from simple sprains to complicated fractures that can have serious consequences if they're not treated the right way. So it's really important for EMTs to stay updated on the latest guidelines.
Right. Got to keep learning. We never stop expanding our knowledge as EMTs.
Yeah.
But hey, speaking of learning, I have one more question for you.
Shoot, it is a challenge, to think about preventing those injuries in the first place, especially with all these extreme sports becoming so popular.
Absolutely. I mean, we see the impact of these injuries firsthand, not just the physical part, but the emotional side too.
Right.
It's not just broken bones. It's like their whole life gets disrupted.
Yeah, you're right. People forget about the mental and emotional impact, but it's so important for us as EMTs to think about that too. Our patients might be scared or anxious, maybe even in denial about how bad the injury really is.
That makes sense.
Mhm.
So how do we deal with those situations? How do we provide emotional support as well as medical care?
It all starts with communication. Just being clear and calm and compassionate can make a huge difference. We got to listen to our patients, let them know that their feelings are valid, and explain everything we're doing so they can understand.
So it's more than just using medical terms.
Mm.
We have to connect with them as people.
Exactly. We got to remember that it's a real person behind every injury with their own story and their own fears.
I love that. Treat the person, not just the injury. That should be like our motto as EMTs. But speaking of treatment, let's go back to those mnemonics for a sec.
Okay.
I know they're useful,
Hmm.
but sometimes it feels like there are just too many to remember. Any tips for keeping them straight?
I think the most important thing is to really understand the purpose behind each one.
Okay.
It's not just random letters. They're there to help us do a good assessment and make sure we get all the important information.
Okay, so focus on the purpose, not just memorizing. Can we go through each one again? Like, why is each one important?
Sure. Let's start with sample history. Remember, that one's all about figuring out the patient's background and what happened before the injury. Each letter gives us a key piece of information. Signs and symptoms, allergies, medications, past medical history, last oral intake, and the events leading up to the incident.
Right. Sample history is like the foundation of our assessment. Now we've got OPQRST for pain. That one helps us really understand the pain, right?
Yep. Onset, provocation, or palliation, quality, region, and radiation, severity, and time. Those 6 parts help us get a detailed picture of what the pain is like.
OPQRST, our pain detective. But let's be real, some patients might have a hard time answering all those questions, especially if they're in a lot of pain or just overwhelmed. What do we do then?
Yeah, it's not always easy. Sometimes we have to get a little creative and adjust our approach. We might need to say things differently, use simpler language, or even just pay attention to their body language to figure out their pain level.
So being flexible and understanding is important. We got to meet our patients where they are, both physically and emotionally. But let's talk about those warning signs we mentioned.
Okay.
Those signs that something more serious might be going on. Can we go over those again just to refresh our memories?
Definitely. Remember those 6 Ps for checking nerves and circulation? Pain, pallor, pulselessness, paresthesia, paralysis, and pressure. Those are the signs that blood flow or nerve function might be compromised. Those are the ones we got to watch out for.
6 Ts, got it. We need to be on high alert for those. But what if we do see one or more of those warning signs? What do we do?
That's when we got to get them to the hospital fast. Time is super important in those situations. We need to stabilize them as best we can, give them supportive care, and get them to the hospital as quickly and safely as possible.
Right, rapid transport when those red flags are up. But even in less urgent situations, we still have to make smart decisions about transporting them, right?
Yeah, absolutely. We got to think about things like how bad the injury is, how they're doing overall, how far the hospital is, and what kind of care they can get there. Sometimes a regular ambulance is fine, but sometimes we might need to call for a helicopter.
So transport decisions are all about thinking about the risks and benefits. And of
Yeah.
course, however we transport them, we gotta keep them safe and comfortable along the way.
For sure. And remember that communication piece we talked about before. It's just as important during transport.
Right,
Keep them in the loop, answer any questions they have, and offer reassurance. Let them know we're there for them.
right. Communication is key all the way to the hospital. And with that, I think we've covered a lot today. We talked about scene safety, the steps in the assessment process, those mnemonics, the red flags to look out for, and of course, how important communication and documentation are.
Yeah, we did. And remember, as EMTs, we have a responsibility to provide good care to our patients. We're often the first people they see when they're hurt, and what we do can have a big impact on them.
Well said. So keep learning, keep practicing, and keep being the best EMTs you can be. And thanks for joining us on this deep dive. Until next time, stay safe out there.